surgery. But I thought it'd be interesting because I don't think we've ever talked about what are the most dangerous surgeries out there, you know. And interestingly enough, I've done a lot of these just because my background before plastics was general and trauma surgery. And so a lot of these actually have some personal experience with. So as we've talked about in the past, overall surgery is very safe. If you look at all surgeries that are being done, so this would include things like I do, such as elective plastic surgery, up to things like heart transplants or even trauma surgeries where people are shot or in bad car wrecks. If you take all surgeries across the board, your overall risk of dying is 0.5%. So that's 1 out of 200. That sounds kind of scary whenever you see that number, but you do have to realize that there are a lot of people who go into surgery with life-threatening emergencies, and realistically, they're probably not going to make it through the surgery. So that does skew it. So some of the factors that affect what the mortality rate for a surgery will be, I mean, there's some obvious things like patient age. Younger people tend to do a little bit better with surgery. Overall health, if you're overall very healthy, in great shape, you're going to have a better chance of coming through than somebody who has 10 chronic diseases. Whether or not the surgery is elective, emergent, or traumatic, those make a huge difference. I mean, trauma surgeries are going to have some of the highest mortality rates, followed by emergent surgeries, and lastly would be things like I do that are more elective. Complexity of surgery, obviously, taking off a mole is not going to have as high of a mortality rate as a heart transplant. And then lastly, overall surgery team skill. So, where you have your surgery does make a difference, whether it's, a level 1 trauma center or, somebody's office does make some amount of difference. So for elective surgeries, because I'm going to leave out trauma surgeries because those are just so random. I mean, it's hard to get an estimate of what is the risk of dying if you have a gunshot and make surgery. I mean, that's so just esoteric. I mean, a lot of people, basically dead when they come in, but they still go to surgery. So that's hard to evaluate. So I'm going to kind of leave out some of the traumatic surgeries. For elective surgery, though, it is lower. So if you leave out trauma, the risk of surgery goes down to like 0.1 to 0.2%. So I want to go through some of the surgeries that carry the highest risk and kind of start at the top and go down. So the first would be any surgery related to a abdominal aortic aneurysm. So have you guys ever heard of the aorta? Does that ring a bell?
I've heard of it before,
yeah. So the aorta is the major blood vessel that comes out of your heart. So your heart sits here, and there's a vessel called the ascending aorta, and then it kind of goes down, and it has all these branches which supply blood to all your organs and basically keeps you alive. And as we age, the aorta in some people can almost get dilated. I mean, specifically it's called an aneurysm, which is just a doctor word for a unusual dilation. But what happens is just like a tire that gets overinflated, as the aorta gets overinflated or stretched out, the walls get thinner and thinner and thinner and thinner. So as it gets larger, the risk of it rupturing goes up and up. And the problem is this is your main blood vessel. This is it. If this thing ruptures, you are in really, really, really bad shape. In fact, for people who have a rupture, at home, 50% of people die before they make it to the hospital. So half the people do make it to the hospital, and then they'll go in for emergent AAA repair, abdominal aortic aneurysm. And I've actually done these surgeries. I worked several shifts doing vascular surgery. And in the trauma hospital I was at, even some of our general surgeons did these. They're very hectic when it comes in and somebody has a ruptured AAA. It's just like they were shot. You have to get them in there and work really fast.
Sounds terrible.
But for those people that make it to surgery, about 40% of those people die. So that would probably be the top, a AAA repair. 40% mortality for an acute rupture. Now, if it's elective, say someone knows they have an aneurysm, but it hasn't ruptured, it's still up to 10% mortality for that, just depending on various factors, because they tend to be older patients, and they are very big surgeries that potentially have a lot of complications. And interestingly enough, there's a famous person that died from a AAA rupture, and that was Albert Einstein, the famous scientist. Yeah, I tried to find somebody noteworthy that had something.
Yeah, he's pretty noteworthy.
I figure Albert Einstein's pretty big. So next on the list would be cranial decompression. So that's kind of a generic term for any surgery where you're taking part of the skull off. And so that can be for various reasons. It could be for a brain infection, could be for trauma. Someone bumps their head. I said I was going to leave off trauma, but there are other reasons why someone would have a cranial decompression. But this surgery basically takes part of the skull off to alleviate pressure inside your brain. Swelling of the brain is a very, very dangerous thing because our cranium, our skull, is not expandable.
Yeah,
and so if the brain starts to swell, it immediately starts to press against your skull, and it can actually kill the brain tissue, which then makes the swelling worse, which then kills more tissue, and it's kind of a cyclical thing that can quickly result in people dying. So when people do get swelling in the brain, a decompression, cranial decompression is the surgery that they would do. I've done sort of these surgeries. I didn't do a lot of neurosurgery, but I did do cranial vault reconstruction for kids with craniosynostosis, which is where the skull doesn't unfuse correctly, or it fuses too early, and then they'll have the skulls where it's normal on one side and then misshapen. And so I worked with a really famous craniofacial surgeon when I was in my plastic surgery training, and we did a lot of those, which is a form of cranial. You're doing the surgery for cranial decompression, but without the actual swelling of the brain. And it is dangerous. He's a fantastic surgeon, but I know for a fact that there was at least one patient that died while I was there. I wasn't in on the case because it's just dangerous surgery. I mean, you're literally taking your skull off your brain, and bleeding can happen, and things can really, get out of hand quickly. But mortality rate for that's 26%. So for people who have to have a cranial decompression, 1 out of 4.
Very serious.
That's serious stuff. I mean, you don't want to have to have your skull taken off. So moving back to the aorta, so the next would be aortic dissection. So this is kind of a more unknown thing. So when you look at the aorta, if you were to cut it, in half and look, on the inside of it, there's different layers of it.
Yeah.
So a dissection is when the blood flow actually doesn't go through the center channel, but it gets in between the separate walls of the aorta itself. Okay. And it's almost as though it's finding a different route to push the blood. Well, what happens is when the blood goes in there, the pressure separates the walls, and then it occludes the place where the blood should go.
Yeah.
So these are very, very dangerous things that happen. It immediately causes people to, have all these very serious symptoms or potentially cardiac arrest. And so the surgery to fix these is a really big deal because you have to get into it normally happen high up, like on the ascending aorta. So you're having to get inside the chest. Mortality rate for that's 22%. So about a little over 1 in 5 patients who go to surgery for that die. John Ritter.
Yes.
Who was
Three's Company.
He died of aortic dissection.
Yeah.
I think I scrubbed into one of those cases. I don't have a lot of experience with those. I think maybe I was on cardiothoracic when one came through. I can't remember if it was elective or emergent, but they are pretty big surgeries.
Yeah. That sounds.
Next would be liver transplant. I've actually done a few of these. We had a really big transplant program at the place where I trained. This is probably my least favorite surgery in the world to do. You don't transplant someone's liver because they have a great liver. And so when you're trying to get the old liver out, it just sucks so bad. Like they're usually really scarred up, very difficult to get out. Then you're having to take a donor liver, put it in, hook everything back up. The longest surgery I ever scrubbed was a liver transplant. It was somewhere around 13 hours for a single surgery, which is brutal. And these do carry a lot of risk. I mean, just the fact that you're taking an organ as complex as the liver out and then putting a new one in and hooking everything back up, there's just a lot of potential.
Yeah, it's huge.
Yeah, I mean, it's you're just saying it in words, it's like, you can really do that? I mean, you can, but it does have some potential problems. And so mortality rate for that's 10%. And, it's an interesting story. One of the very first patients, I did transplant first when I was an intern. And I'll never forget this story. So a guy came in, and he was a surgeon.
Okay.
And he had hepatitis C that he got from a needle stick in surgery, and his liver was failing, and so he needed a liver transplant. And when he came in, he was actually in pretty good shape, because when you're in liver failure, it's not as though you're always on death's door. I mean, it can be controlled to a certain degree. Anyway, so he came in, and we had found a liver for him, so we did his transplant. And then he had what's called an acute rejection. So even though he matched up to the liver donor, his body just rejected that liver. And so when that happens, you literally have a day or two to find a new liver, or they die.
Right.
So we found another liver for him, miraculously, took him back to surgery, put the new liver in, and then he rejected that one as well. And then he ended up dying which is, I mean, it's one of those things. I mean,
I thought like somebody in my family died of hepatitis C from
really?
From they had
Blood
liver
transfusion.
Yeah, blood transfusion. Like, how do they not? Like, how is that?
Well,
how does that happen?
I mean, so there was a time in the past when they didn't necessarily scan blood for all these various things.
He was like an alcoholic and like had to like have all. He was like his liver was just horrible.
So I mean, if you're an alcoholic and you have hepatitis C, that's like the double whammy. I mean, that's really bad.
He died as soon, like very quickly.
Like liver failure in general is bad, but if you're an alcoholic where you have cirrhosis of your liver.
Yes, that's what he was getting blood transfusions for, I guess.
Oh, okay. Well, he probably could have got from blood transfusion.
Yeah.
Anyway, so liver transplant, serious stuff. Mickey Mantle died after a liver transplant. He had liver failure, and he did get a transplant. And I think he died like a month later. So, huh?
I said, oh.
Yeah.
Yeah.
I actually met Mickey Mantle a long time ago, back in the 90s. I was a big, huh?
I said, interesting.
He was I was really into baseball when I was a kid, and he obviously had retired, but he would do these baseball card shows and sign autographs.
That's cool.
And I had a friend who would take me to the baseball card shows, and so I got to meet Mickey Mantle and got his autograph. He was a cool dude. Lung resections. So people that get a lung resection, there's various reasons. Cancer is generally the big one. If you have a tumor, you want to resect that if it's even possible. So lung resection can carry a 5 to 10% mortality rate, which is pretty high. That does depend on how much of the lung you're taking out. Some people will get just a part of their lung taken out, like a small part. Okay. Other people need the entire thing taken out, so that's why there's that.
Can you live with one lung?
You can, yeah.
Oh.
You can, yeah. So anyway, that's another big one. I mean, you're getting inside the chest. If you get infection post-op, I mean, that's very serious. You can get sepsis really fast, so that's another really, really big surgery. Another resection is following that one is colon resection, 5% mortality rate. Now, that's a little bit skewing because a lot of people get their colons out and not 1 out of 20 people die from a colon resection. But what this does include is people who've had some sort of perforation of their colon. So there's some disease processes where the colon will pop inside of you and it dumps all that stool in your body and then you get super, super sick and then they come in and they do a colon resection. Those people are much more likely to die than if you say, you go to colonoscopy and you got a tumor and they got to cut it out. You're probably going to be okay from that, at least from the surgery. Another resection, pancreatic resection. This is an interesting one. This is a procedure called the Whipple. So if you get pancreatic cancer, there's a procedure that takes out the pancreas, part of the small bowel, and part of the stomach, and then hooks everything back up. They call it a Whipple procedure. I did a bunch of those in training because we had a couple guys that were really known for doing them. Very tedious surgeries. I really didn't like doing them. In fact, I was talking to my general surgery friends just this week about them, and we both hated doing them when we were there.
Sounds.
Yeah, it's very tedious.
Critical.
And, yeah, just I don't know.
Detailed.
Yeah. So 3% mortality rate with that. So we're getting lesser, but still 3% mortality rate is pretty high. I mean, that's not insignificant. So next is a straight up heart bypass, CABG. Yeah. They call it coronary artery bypass grafting. You could call them CABGs, CABG for short. 2.5% mortality rate. So that's what, 1 out of 25, I guess? Yeah, I think about it. So yeah, I mean, for the obvious reasons, when you're working on the heart, there's always the risk of something happening. The graft that you do can go bad. You get an infection.
That happened to my friend's dad. She had
really,
or her dad had gotten an infection, and he was literally getting nurses coming to their house. It was like his chest was open still.
Oh right, so
and
actually
they were cleaning it.
But did he do okay?
No, he's fine. He's alive.
Okay, good.
Yeah.
I actually do those surgeries, so that would be a sternal dehiscence after CABG or any sternotomy procedure. So a lot of times plastic surgeons will come in to fix those, and also wound care doctors, which I'm not really a wound care doctor. I'm just a plastic surgeon that does wound care, but I see a lot of patients with sternal dehiscences after CABG. Unfortunately, it's just one of those things where when you cut open the chest and you sew it back together, it doesn't always heal great.
Yeah, it just wasn't healing.
Yeah.
I just remember, whenever we were kids playing at our house, we'd be like, oh, we got to leave because we don't want to see.
Right, yeah.
Because he would literally just, sit in the living room, sitting on his recliner with this nurse, cleaning his stuff.
I have a crazy video of a surgery that I did. I'll bring it next week. It was a patient I got consulted on, and it was a patient whose sternum dehisced so much that you could literally see the heart beating in the bottom of the wound. It was crazy. And so I fixed it. It's a really cool. I'll have to. It's a video. It's maybe like a minute long.
Is it as gross as that other video you showed us? It looked like there was a person inside of.
Yeah, probably so. Yeah.
Oh, very nice.
Yeah. I posted that, and I really thought that thing would go wild. And I don't know if it's getting throttled or what, but really, I don't know. People were not interested in that.
You posted it like on social media?
Oh yeah, absolutely.
When?
This past week.
I didn't see it. It didn't pop up on my feed, so it must not be getting.
Maybe we just posted it to YouTube Short as a test. I thought we posted it to Insta too. I wonder if it's getting throttled because it's like medical. I don't know. I can never understand social media.
Me either.
It's just crazy. Lastly, I put on there just as a what's it called? What's it called when it's not, you don't get an award, but you're honorable mention.
Yeah. Oh, okay.
Honorable mention. I put Brazilian butt lift on there.
Oh.
It's much lower.
We hate it.
Huh?
I said we hate it.
I hate Brazilian butt lift. 0.02 to 0.03% mortality rate, which actually for elective plastic surgery is very high.
Yes.
Like that's
we know
one
this.
in that's 1 in 3 to 5,000.
And then it goes up if you go to Florida to get it.
Speaking of which, I had two patients this week come to my office that went to Mexico to get tummy tucks and were having back complications.
Yikes.
In fact, the first one came, and then my next office day, my nurse was like, okay, we got a patient with, went to tummy tuck, went to Mexico to get a tummy tuck. I was like, we just saw that patient. She's like, no, this is another one. I had another one, 2 in a week. Pretty crazy, right?
It's insane.
Wild stuff.
I
Anyway,
would never do that.
let me know what you think about the most dangerous surgeries out there. I did leave out things like gunshots and crazy car wrecks just because those are so hard to kind of quantify. But if you have any questions about those surgeries, please leave me a comment. I'd love to know what you think.